I was surprised when I got involved in this that this data wasn't currently available more universally throughout Scotland. So I see it as a way of being able to access more consistently and across Scotland information about the public's health and their needs going forward. Historically, there was two ways of getting information. There was a cluster of practices, about 60 or 70 strong, that were gave permission to allow their data to be used. But since there's well over 1,000 practices in Scotland, it was a small proportion. The other way was that researchers would make contact with individual practices to ask them to provide data. So this system will allow the information to be extracted more easily and more consistently across Scotland for those practices that agree to participate in SPIRE. I think it will be more secure. I mean, I think historically, I think there has been potential for breaches of security through the more widespread way of accessing patient information in GP records. And I think this will streamline and make more secure. Nothing is ever 100% foolproof, but I think I have much more confidence that this will be a secure way of accessing information. Well, my view is that historically we have tended to go from the hospital data into GP data, but in truth, where do most people go for their health care? So if you can access patients' information at that point and do it more universally throughout Scotland, then that must be a significant benefit to be able to understand patterns, things that aren't consistent. Why? Is it there's some reason for patients suffering certain conditions in certain parts of the country? I think it will allow researchers a more streamlined way of getting approval. Initially, it may be a little bit bureaucratic till it settles down and people get experience, but it will allow researchers to make a case to access patient data and for what purposes and what safeguards will be put in place. I think that will mean that Scotland will have access to more rich and detailed information which can only help people understand who need to understand the patterns, the hotspots, and therefore think of ways to serve their communities better.